Okay, so welcome to this next video in which we are discussing the drug treatment of rheumatoid arthritis. Okay, so in this video what we're going to move on to is immunosuppressant drugs. Okay, so we've already seen that glucocorticoids are going to produce an immunosuppressive action. Okay, they prevent the production of interleukin-2 and thereby prevent activation of T cells, and they also cause glucocorticoid-induced apoptosis within T and B lymphocytes, and therefore can downregulate the numbers of T cells and B cells, and also plasma cells which you have, and thereby reduce your production of antibody, which is obviously crucial to continuing the chronic inflammation that you have in rheumatoid arthritis. Okay, you have to continue producing the antibody. The antibody goes into the synovial membrane, and the synovial fluid finds its autoantigen, binds to it, forms an immune complex, and that continues the acute, well, not so acute anymore, but the inflammatory response occurring within that synovial joint. Okay, so we're going to see other drugs now that work by stopping T cell activation, and therefore are going to stop the propagation of the adaptive immune response forward, basically by stopping the activation of the T cell by the professional antigen presenting cell. Okay, so the first drug we are going to look at is a drug known as abatacept. Okay, so let's just have a bit of a reminder of how T cell activation occurs. So let me just find the piece of paper. So here we have our professional antigen presenting cell presenting some autoantigen fragment on an MHC class II molecule, which is bound to the T cell receptor on the surface of a CD4 positive naive T cell, and the CD4 has then also bound to the MHC class II. Now, on the surface of the dendritic cell there are two co-stimulatory molecules that are also required to activate the CD4 positive naive T cell. To give the CD4 positive naive T cell signal 2, you need CD40 to bind to CD40 ligand and B7 to bind to CD28. Okay, if you just give signal 1 alone, which comes from the T cell receptor and the CD4, then that's not enough to induce the increase in expression of interleukin-2 and interleukin-2 receptor alpha. So you need signal 2 as well. Now, abatacept is going to work by binding to B7 molecules, okay, and preventing the B7 molecule from being able to bind to the CD28. So let me show this here. So, if we have our B7 molecule here on the surface of our dendritic cell, what's going to happen is that this drug, abatacept, okay, which I'm going to show here, is a drug which will bind over the surface of the B7 molecule, whether this is B7.1 or B7.2, it will do it to both of them. Okay, and now B7 won't be able to bind to the CD28 on the surface of the naive CD4 positive T cell, okay, and therefore you won't be able to generate signal 2 basically. So this is one way of preventing antigen presenting cells from being able to activate CD4 positive naive T cells, or indeed activate any sort of T cell. Okay, so by covering up the co-stimulatory molecule with this drug abatacept, you can block the activation of T cells. Now the next drug we're going to turn our attention to works slightly further down the pathway. Okay, so the next collection of drugs that we're going to look at are going to work by blocking a step that we didn't look at the time when I described CD4 positive naive T cell activation to you, which is how does signal 1 and signal 2 cause an increase in the expression of interleukin-2 and the interleukin-2 receptor alpha subunit within this CD4 positive naive T cell. So we're going to look at this step now in more detail so that we can understand how certain immunosuppressive drugs are going to work. Okay, right. So, let's say we have got signal 1 and signal 2, so we've had activation of the CD4 and the T cell receptor, which has given us signal 1, and we've also got activation of CD28 and CD40 ligand, which has given us signal 2. Now when you get both of these, what happens is that calcium level within the cytoplasm of the CD4 positive naive T cell goes up. Okay? And what does this calcium do? Well, it binds to a protein known as Calmodulin. So let me just discuss with you the structure of Calmodulin. Okay, so Calmodulin is a protein that has a bilobed structure. So it has two lobes. So I've drawn one here, and here's the other one here. Okay, and it has a linker between these two lobes, like so. Okay, so one of these lobes is called the N lobe, so we'll let this be the N lobe, and the other is called the C lobe. Okay, now both the N lobe and the C lobe both have two calcium binding sites. So here on the N lobe we have two calcium binding sites, and here on the C lobe we also have two calcium binding sites. Okay, now this structure that I've shown you here is the structure of Calmodulin when it has no calcium bound to its calcium binding sites, and the structure of calcium when it has no calcium bound to its binding sites is sort of hunched over like this. The two lobes are kind of folded back in on one another, okay? And this structure is known as apocalmodulin. Okay, now, when calcium binds to the calcium binding sites, and of course we've got 4 calcium binding sites, so we're going to need 4 calcium ions to come along, what happens is the molecule changes in structure. Okay, it springs back out basically. The two move sort of away from each other. It unfolds basically like so. Okay, and contrary to the whole molecule straightening out, this linker region is then going to adopt an alpha helical structure. So let me show this. So it goes from being a linear polypeptide to having an alpha helical structure. Okay, and here is the C lobe of Calmodulin. Right, so this is when calcium is bound to the calcium binding sites. So let me put a coloured dot in each of those calcium binding sites to represent that there is a calcium ion bound in each one. Okay, so here is a calcium ion, here is another calcium ion, and here are the final ones. So those green dots represent the calcium ions which are now bound to the calcium binding sites. Okay, and this structure now where you have calcium bound to the Calmodulin is called a calcium-calmodulin complex. Okay, right. And one final thing I want to say is that there are shorthands for both apocalmodulin and calcium-calmodulin complex. So the shorthand for apocalmodulin is to call it apocam, and you put uppercase C, lowercase a, uppercase m. And the shorthand for calcium-calmodulin complex is to put Ca2+, and then cam again, where you have the same abbreviation for calmodulin, uppercase C, lowercase a, uppercase m. Okay, so when calcium goes up, you get calcium binding to calmodulin molecules and the formation of calcium-calmodulin complexes. Now, these calcium-calmodulin complexes are going to bind to and activate an enzyme. Okay, so let me show this enzyme here. And this enzyme is within the cytoplasm of cells. Okay, so here it is. I'm drawing it with the typical enzyme structure. It's got a very obvious active site. And this enzyme is what's known as calcineurin. Okay, so calcineurin is usually sitting within the cytoplasm and it's inactive. And by the way, there's an abbreviation for calcineurin, which is similar to calmodulin. It's uppercase C, lowercase a, and then uppercase N, like that. So calcineurin. Right, and as I said, it's usually sitting within the cytoplasm inactive, but once you've got calcium-calmodulin complexes forming within the cytoplasm, these calcium-calmodulin complexes can bind to calcineurin. So let me show one here. So here is a calcium-calmodulin complex bound to the calcineurin. And this calcium-calmodulin complex binding to the calcineurin is going to activate the calcineurin. Now, what is calcineurin? Well, basically it's an enzyme which removes phosphate groups from serine and threonine residues. So it's what's known as a serine-threonine phosphatase. So if you have serine and threonine residues within proteins which have had phosphate groups stuck onto them, this enzyme will remove those phosphate groups. Okay, so it's a serine-threonine phosphatase. Now, there is a protein in the cytoplasm of cells, which has a huge number of phosphate groups stuck onto serine residues of this protein, okay, and that they're going to be removed by this calcineurin. So let me just talk a little bit about this protein. Okay, so this protein is what's known as the nuclear factor of activated T cells. Okay, and it's clearly named after the fact that it's going to be activated by signal 1 and signal 2 within a T cell. So nuclear factor of activated T cells. And for short, the nuclear factor of activated T cells is abbreviated to NFAT. So NF for nuclear factor, and then AT for activated T cells. Okay, so NFAT is actually a transcription factor, so it can go into the nucleus and bind to the promoter regions of certain genes and increase the expression of certain genes and decrease the expression of others. So you can probably begin to see how this is all going to piece together now. Okay, and this nuclear factor of activated T cells, usually it's inactivated, okay, so it's sitting within the cytoplasm and it's inactive, and the reason it's inactive is that it cannot work in the cytoplasm. In order to work, it has to go to the nucleus where the DNA is, okay, but it's trapped in the cytoplasm, and the reason is that it has a special region known as the serine-rich region, okay, which is often just abbreviated to SRR for short. Okay, and the serine amino acids in this portion of this protein are phosphorylated usually. Okay, so I'll draw these phosphate groups here. So these are meant to represent phosphate groups. I'll colour them in purple to get the message across. Okay, so you have a lot of phosphorylated serine residues in this serine-rich region of the nuclear factor of activated T cells. Now, these phosphate groups on the serines in the serine-rich region of the nuclear factor of activated T cells trap the nuclear factor of activated T cells in the cytoplasm and stop it from going into the nucleus. Now, we have just activated calcineurin, which is a serine-threonine phosphatase, so of course it's going to go over to the nuclear factor of activated T cells and chop off these phosphate groups which are on the serine residues within the serine-rich region, and now the nuclear factor of activated T cells can go into the nucleus and it can act as a transcription factor in the nucleus, so it will increase the expression of certain genes and decrease the expression of other genes. And two of the genes that it's going to increase the expression of are then interleukin 2 and then also the interleukin 2 receptor alpha. So basically, we have just looked at the pathway in a bit more detail. Before, we just abbreviated this whole thing to signal 1 and signal 2 caused interleukin 2 and interleukin 2 receptor alpha subunit to be produced. Now we've actually looked at the pathway that occurs within the cells for that to actually happen. Okay, right, so why have we looked at this molecular pathway in this detail? Well, it's because we need to in order to understand how certain immunosuppressive drugs are going to work. So, two drugs are going to work by inhibiting calcineurin and stopping it from being activated by calcium calmodulin complexes. And then if you don't activate calcineurin, it's not going to remove the phosphate groups from the serine-rich region of the NFAT, and therefore you're not going to get an increase in the expression of interleukin 2 and interleukin 2 receptor alpha, and then you can't go on in the process of activating this T cell. Okay, right. So, what are these immunosuppressive drugs? Well, the first one I want to talk about is a drug known as cyclosporine. Okay, so cyclosporine is the first drug. Now, cyclosporine binds to a protein within the CD4 positive naive T cells, but of course this process is the same for memory T cells, and it's the same for CD8 positive naive T cells as well. So you're going to block the activation of all forms of T cells basically, which is why this drug is so powerful. Okay, and it binds to a protein called cyclophilin. Okay, so I'll show this protein here. So this is cyclophilin. Now, the cyclosporin-cyclophilin complex then goes and binds to calcineurin, and basically stops it from being activated. So even if the calcium calmodulin complex binds to the calcineurin, if it's got this cyclosporine cyclophilin complex attached to it, it's not going to actually become active, and it's not going to remove those phosphate groups from the serine-rich region of the NFAT, and therefore the NFAT will not translocate from the cytoplasm to the nucleus, and you won't get the increase in expression of interleukin-2 and interleukin-2 receptor alpha. Okay, now let's discuss another drug that works in a very similar way and also works to inhibit calcineurin. Okay, so the next drug is a drug known as Tacrolimus. Okay, now Tacrolimus has an old name. Okay, so when you actually market drugs to be used clinically, you give them a nice name that's in that's, you know, that is a word basically. Whereas before drugs have actually been licensed to be used clinically, they have their old pharmacology name, and this is just symbols basically. So the old name for Tacrolimus, which is still often used, and you'll see why in a moment, is FK506. Okay, so that's the name that it was given before it was actually used clinically and was just an experimental drug. Okay, so because of course we come up with a huge number of experimental drugs and we can't afford to give them all fancy names basically, whereas, you know, you can make a huge number of symbols up. Okay, so FK506, and FK506 or Tacrolimus goes into the T cells and will bind to a protein known as FKBP12, and this stands for FK506 binding protein 12. So this is another FK506 binding protein. We saw one back when we were discussing the glucocorticoids. We saw FK binding protein 52. Now we're seeing FK binding protein 12. Okay, so this in full stands for FK506 binding protein 12. Okay, right. And when the Tacrolimus drug binds to the FK506 binding protein 12, this complex of Tacrolimus with the FK binding protein 12 is going to again go and bind to the calcineurin enzyme, and again, just like the cyclosporine cyclophilin complex, when the calcineurin has this Tacrolimus FKBP12 complex bound to it, even if a calcium calmodulin complex comes and binds to it, it will not become activated, and therefore you won't remove the phosphate groups from the serine residues in the serine-rich region, and therefore you will not activate the nuclear factor of activated T cells within this T cell, and the T cell will not be induced to express increased levels of interleukin-2 and interleukin-2 receptor alpha. Okay, right. Now there are two more drugs that I want to discuss in this video before moving on to the next class of drugs. Okay, and the two drugs I want to discuss now are going to work by blocking the interleukin-2 receptor. So let's just remind ourselves of how signal 3 is generated. So to get signal 3, what happens is the interleukin-2 receptor alpha subunit that you've just made goes to the cell membrane and will bind with the beta and the gamma subunit that were already expressed. Okay, so all T cells produce the interleukin-2 receptor beta subunit and the interleukin-2 receptor gamma subunit, but they don't produce the alpha subunit, and they only produce the alpha subunit once they've been activated by signal 1 and signal 2. Okay, the interleukin-2 is then secreted from the T cell, and it then goes back and binds to the now complete interleukin-2 receptor and will then trigger signal 3. And in the next video we will actually examine what signal 3 is, because another immunosuppressant drug, namely rapamycin or sirolimus, is going to work by blocking signal 3, but we'll come back to that. Okay, now just before we get to that, there are drugs which will bind to the extracellular domain of the interleukin-2 receptor and block the interleukin-2 from being able to bind to the interleukin-2 receptor, and therefore block the interleukin-2 from being able to generate signal free within our CD4 positive naive T cell, or maybe a CD8 positive naive T cell, or maybe a memory T cell of some form. Okay, now both of these drugs are monoclonal antibodies which are targeted against the interleukin-2 receptor, and there are two of these. Okay, so one is called basiliximab, okay, and the next is called daclizumab, okay, so daclizumab. Right, and both of these drugs will bind to the extracellular domain of the interleukin-2 receptor and prevent the interleukin-2 from being able to bind, and therefore stop the interleukin-2 from being able to trigger signal free within the CD4 positive naive T cell, or as I say, it could be a CD8 positive naive T cell or a memory T cell. So these two drugs are basiliximab and daclizumab, and they both work by blocking the interleukin-2 from binding to the interleukin-2 receptor. Now in the next video we'll continue our discussion of immunosuppressants by looking at rapamycin, which works by blocking signal free from occurring within the cytoplasm of the CD4 positive naive T cell.